and how their testing can help determine your body's true age.
Yes.
Ooh,
Yes.
okay, how does that work? Yeah,
See, there's a lot more going in our blood than we realize. I think that we, you know, especially as women, we focus a lot on the outside stuff. Like, okay, there's a wrinkle here and there's a crease I don't like there, and, you know, what kind of cream am I supposed to get? But if we ignore what's going on internally, you know, we're really aging. You know, even on the outside, we may be looking perfect, but we could be aging very quickly.
It's only half the battle. Yeah.
Absolutely. So it's so important that we understand, and we've talked a lot about on the show about insulin resistance, but so many women are impacted by this. I mean, I would guess 40% of women
and what
have
sort of
insulin resistance.
effect will that have
so
on you?
It makes you tired. It makes you crave carbohydrates. It makes you, you know, after you eat, hours later, you crash. It makes you gain weight in your abdomen. And I've never been that overweight person, but when I gain weight, it's always right here, and it's so frustrating because you're doing everything right, but you're gaining weight there. And it's just extremely common, especially women who have a history of having had diabetes in pregnancy, much more likely to develop that. And it contributes to aging. They're actually finding that insulin resistance contributes to Alzheimer's disease.
Oh, wow.
So, you know, all sorts of things. So we need to identify this. And when we do identify it, there's lots of things we can do. I mean, diet-wise, you know, staying away from processed foods, staying away from sugars, probably the low-carb way to go is better just because there's more processing and a lot of carbohydrates.
Can you explain why to stay away from processed foods? Why it's
because,
so bad?
well, processed foods, they don't have a lot of nutritive value, and they have potential to create inflammation in the body, and a lot of times the preservatives can really have an effect that affects the blood vessel walls and makes them more likely that bad particles can get in and begin to form plaque. And
your body
all of
basically
that.
treats it as a toxin. A lot
Yeah,
of it.
it
so
really
it gets
does.
inflamed.
The preservatives and all that.
Absolutely.
So you're talking about those chili cheese tots yesterday?
Probably a little bit processing went on. Just
a little bit of
maybe just
fake
a little bit of
cheese
fake
and-
cheese.
But it's important because it causes that sort of low-grade, constant state of inflammation,
Absolutely.
which is what causes disease, right?
Absolutely. So inflammation plays a huge role. And as you know, when we do blood testing, we look at several different markers of inflammation to try to understand what's going on. And then we look at, and we've talked about before too, vitamin D. The omega-3 index is something that, you know, having a high omega-3 index is protective and has kind of anti-aging properties, so you want to make sure that that's high. And a lot of times people will take an omega-3 supplement because it's hard to get it through diet alone. But the insulin resistance issue, besides diet, sometimes we'll use agents that actually, some of the medications that I use, if I'm going to use medication, something called metformin, which has been shown to have anti-aging properties, anti-diabetes, you know, benefit against heart disease, anti-cancer, and it's like a $4 a month generic
That
drug.
might be
Oh my
the
goodness.
first drug that I've ever heard of that actually benefits inside your body.
Yeah.
In those types of ways instead of harming.
Right.
Because we hear a lot about like people who are on lots of different medications, how it has detrimental effects on your body and how quickly you age and all that kind of stuff.
And I mean, every medication, there's risk benefits of everything. And metformin can't be used in people with kidney issues, and because it's metabolized through the kidneys. It can drop your B12 level a little bit when you take metformin, so I usually recommend B12 supplements anyway. People always ask me, like, what do you do? Like,
Right.
What do you take?
We've asked you.
What is it you want to take?
The camera goes
so
off,
I
I'm like,
take
okay, now what do you really do?
5,000 vitamin D3,
Yes,
little
it's
gel
a-
caps.
it's
I got some after you
5,000.
told me.
Yeah,
and
you
I can
probably
tell the
needed
difference.
10,000, honey, because
Oh,
you were
should I
really
take
low.
more?
Well, I
10,000 for a
think
month.
5,000 might not touch you because you were low.
Is it 10,000
At least,
for a month?
probably a month, and
To
then
get
go
your
down to
boosted and then
5,000,
get-
right?
yeah.
Just because you were so low.
Sure.
And we've talked
Okay.
about that on
Good to
every
know.
I use.
I wouldn't do 10,000 for everyone. I'd say I do
For me.
5,000. Yeah, talking about.
I use, not milligrams.
No, I use. And then I take 4,000 milligrams of fish oil, omega-3, EPA, DHA, and I've been doing that for a decade, and I think that's really good for skin and hair. I take B12 because I'm also on metformin, but I take metformin for insulin resistance. I had I had gestational diabetes twice. 2 pregnancies 10 and 12 years ago, and I know that I'm at risk and I have insulin resistance, and even though I'm thin, you know, it affects me as much as it can affect anyone who's overweight.
Did you say D3 also?
Vitamin D3.
Yeah.
It's D3.
5,000 is what I take. Anywhere between 2,000 and 5,000 is really pretty safe.
What do you think about B12 shots as opposed to the B12 caplets?
So the thing with B12 is it's poorly absorbed. So if you're going to take B12 orally, you want to get the sublingual, under the tongue, dissolvable one.
Okay.
If you have, there's certain diseases called once pernicious anemia where you don't have this intrinsic factor, which means you're not going to absorb much at all if it gets into your gut, and then you need injections. Most people don't need injections, actually. I've been using B12 sublingually in women for years and years and years.
Okay.
Usually 1,000 milligrams is all we need.
Do you have to have a prescription for that? kind?
No.
Okay.
No, you can just get that over the counter. Sublingual B12.
You know what we need to do? We need to do like a Ask Dr. Dall thing and like let people, you know,
Sure.
email us with their questions
That's a
for
good
the
idea.
next time
Sure.
you're here.
That'd be
Maybe-
great.
Happy to do that. That'd be fun.
Work on something like that. Okay.